Thank you very much, Mr. Fonopondo. Good morning to you all. And as been mentioned, my names are Dr. Sarah Biachika, the Commissioner Planning, Financing and Policy of the Ministry of Health. And they made a decision or passed the National Health Insurance Bill 2019, which will be tabled in Parliament for discussion. So I take this opportunity to give you some highlights of what is contained in this National Health Insurance Scheme. The National Health Insurance Scheme is to cover all residents in Uganda in terms of medical or health insurance. And it's good for us to understand what health insurance is. It is a form of social protection which aims at ensuring that those members who have contributed and their dependents are protected from high and unpredictable cost of seeking quality health care. We all know that many times illnesses don't make appointments. So you may be healthy this morning, but by evening you are taken down seriously ill, or you are involved in a road traffic accident or any other condition that will affect your health, and you have to get care, seek health care. So, but many times we have realized that the current situation may not allow the population to obtain all the care they require in time, and more so quality health care, because of some inadequacies we have as far as financing for health is concerned. So the objective of this scheme is to develop health insurance as a mechanism for financing health care in Uganda. We all know that we have financing from government, we have financing from partners, but a large proportion, as I'll mention later on, is out-of-pocket financing for health. So we want to formalize that out-of-pocket as a financing mechanism for health care in Uganda. The other objective of the scheme is to facilitate the provision of efficient, equitable, accessible, affordable, and quality health care to all residents in Uganda. Many of the gaps that we know or we have in the current healthcare system are related to inadequacies, for example, stockouts of medicines. Health workers may not be adequate or may be absent because of they are not well incentivized once in a while, including the private sector. They may fail to attract the qualified healthcare workers because they don't have the money to pay them. So, but if we have the health insurance and even including private health providers, and they get this assured financing from the population for health, then they will be able to have the human resources that are required even in the private sector to ensure quality of health care, equity, and appropriate utilization of health services. Because the facilities will be earning money from health insurance, and this money is not easy come money, they will make sure they have to put this money to proper use to ensure that there is no stock out of medicines. Because if I have paid for my health insurance and I go to a facility and I'm told there are no medicines, that will be an issue. I'll demand because I'm entitled. So even the accredited providers will assure, with the health insurance in place, they'll ensure that they efficiently and effectively utilize the available resources to ensure that the population can access quality health services. So this health insurance bill has been formulated within the context of provisions of the Constitution of the Republic of Uganda, 1995, as amended, whereby it is stated that the state shall ensure that all development efforts are directed at ensuring the maximum social and cultural well-being of the people, and that all Ugandans enjoy rights and opportunities and access to health services, among others. This bill is also in line with the Sustainable Development Goal Agenda, which I'm sure you are all aware about, but specifically Goal 3, which aims at ensuring healthy lives and promoting well-being for all at all ages. It aims at making sure that everyone has health coverage and access to safe and effective medicines and vaccines. So why at this time are we talking, or what is the justification for health? Because many of you, we are all aware that the government policy is provision of free health care services. So while Uganda as a country provides free health care services at the point of consumption in government health facilities, except for the private wings in the hospitals, we have found that households still experience very high out-of-pocket expenditure on health. They still have to pay to really get some of the health services. And their studies have shown that if we are to put together all the money that is spent on health services in Uganda, all 41% is out-of-pocket expenditure. It is not covered within what government provides under the free health services policy. Donors contribute 42% of the total health expenditure, and the government of Uganda expenditure is only 15% of the total health expenditure. So the budget allocated to the health sector is only 15% of what the entire population in Uganda spends on health care, because not everyone goes to the public facilities or government facilities where we provide that free health care. There are private hospitals, there are private clinics, and all that. And then only 2% are covered under health or private health insurance schemes or some other prepayment mechanisms. So this implies that if somebody is sick and seeks services which probably or maybe are not provided at the government facilities where we expect free health care, they have to pay for those services from the private pocket, or they have to get that from the private sector. Paying for health care is not bad, but the challenge is that if you pay it when you are not prepared for it. So it is said that out-of-pocket expenditure above 10% of the total household income is considered catastrophic, because it will lead you to poverty. There are many instances when, for example, patients have a chronic illness, or patients get an accident, a person gets an accident, but they have to sell some household property, cows, goats, something, to be able to seek care. That leads to impoverishment, and that is catastrophic. And as we are talking about development, health and development, human capital development, to contribute to national development, we cannot just let that status quo remain. we have to see how do we now harness this out-of-pocket expenditure and use it in a prepaid form so that people do not have to be to spend to get money out of their pocket when they have not planned for it. So the scheme is necessary for protecting all individuals and households from unpredictable costs for seeking quality health care. This will protect members from selling household items or assets which lead them into poverty, since they will now not need money at the time when they access health care. Once you have paid, you have prepaid, you have your card, it means that once you fall sick, all you need to do is look for where your card is and walk to the accredited health facility. Instead of us saying, now I'm sick, what can I sell? Or who can lend me money before I go to a facility? You have prepaid. That is what health insurance is. You just pick your card and you go and get the services. So the National Health Insurance Scheme will be established and manage contributions from members and disburse payments to accredited healthcare providers. It's important to note that the scheme will pay for a specified benefits package of services accessed by the scheme members and their dependents. It's a defined package. It is not open. We shall have a package, what we can afford. As I said, we are still a growing country. Our income levels are still low. We don't want to milk the population beyond what they can. So we are going to start with a specified package based on the Uganda National Minimum Health Care Package, and members will contribute. But as we said, the scheme will be growing with time, so we expect that as the scheme grows, then even the benefits package, that is the range of services that can be accessed using that card, will also continue growing. We shall be at an opportune time, or once the scheme is approved, because it still yet has to be approved and become law, we shall at an opportune time discuss the details of the package. But we shall start with a package that covers most of the common disease conditions in the country, so that most of the people will be able to benefit from their contributions. The national health with the private commercial health insurers, because we know right now we also have private commercial health insurance schemes, but as I mentioned, they cover less than 2% of the population. They will continue, but to provide supplementary package of services that will not be covered under the benefits package of the National Health Insurance Scheme. I would also like to mention that, and as I said, it's very important to understand that health insurance does not mean, as we are now when we start, will not mean that it will be the only source of financing. I elaborated that right now we have up to 4 different sources of financing. Government through tax revenue, we have out of pocket, we have donor funding, we also have a small 2% from prepaid schemes like the commercial health insurance. So by introduction of the National Health Insurance Scheme does not mean that we are going to cease government funding for health services as of now. But government will continue funding public health interventions that are not covered under the benefits package. For example, health promotion and education, advocacy for health, immunization, disease surveillance and response, and any other specialized services outside the NHIS benefit package. It will continue investing in the health system, for example, health infrastructure development, so that we have the facilities that are required, human resource, that the health workers are available, specialized medicines, and technology. But this will be at a reducing scale until such a time that the scheme has grown in future, and then probably consideration will be taken to have maybe one national health fund, as is stated in the health financing policy. Let me talk about the contribution. Stated that any person who has attained the age of 18 years and who is ordinarily a resident in Uganda shall be liable as a contributor to the National Health Insurance Scheme. I said it is mandatory. All residents should be under the scheme. But as they are covered, not everybody contributes. But once you are 18 years and above, then you are eligible to be a contributor to the National Health Insurance Scheme. And a contribution shall be at a rate depending on the total income of the person liable to making a contribution. In case of a person whose income is derived from salaried employment, for example, a formal employee, you get a monthly salary, a monthly deduction will be made from your salary by the employer, and a contribution will also be made by the employer to make your total contribution. And in case of a person whose income is derived from self-employment, whom we call the informal sector largely, they will make an annual contribution in a manner and a rate as may be determined by the regulations that will be made for the National Health Insurance Scheme. I'll not go into the details of the how much, because this is still a process, and after the bill is passed, we'll go into the process of making the regulations. We have made some proposals on how much contributions will be made, what the contributions to be made by the formal employees, and also on average. I'll use average, but as I said, the rates will be determined based on income. But for example, for the informal sector, on average, we think it will be about 100,000 per year as contribution for the informal sector. And every contributor, upon payment of the prescribed contribution, will be issued an identification card. So everybody will have a National Health Insurance identification card for purposes of identification and verification before accessing the benefits of this scheme. Vulnerable or poor and very vulnerable. For example, poor orphans, the poor who are categorized as indigents or live below $1.5 per day as per the World Bank definition, or the disabled. So we shall have groups of the disadvantaged, the poor disadvantaged. These will be exempted from the contributions. Although they will be beneficiaries of the schemes, they will not be paying. After identifying these, we shall work in collaboration with the respective entities like Ministry of Gender, the local councils, local governments, LCs, to identify these people. But once they are identified, they will be also issued with identification cards so that they can benefit, although they will not be contributing to the social health insurance scheme. So once you have contributed, as I said, 18 and above, you should contribute. But we know that not everybody under 18 and above can contribute, so I'll elaborate a little more. For everybody who contributes, or every contributor, there will be a spouse and child of that contributor entitled to all the benefits of this of the health insurance, irrespective of the amount that you have contributed. Once you are issued a card, you are entitled to benefits. But as I said, the contributions are based on your income. But when we go to benefit, we don't differentiate that you contributed more than me, so I have better access. No, we all have the same benefits despite contributing different amounts. But when we talk of a child, I said you'll have a contributor, spouse, and a child. I don't mean one child, but we have defined child in this bill to mean child means a child of a contributor who has not attained the age of 18, or having attained the age of 18 has no income of his or her own and is still living with a contributor, or is a person with a disability who is wholly dependent on and living with a contributor, that is a dependent, and is undergoing a full-time course of education and is not in receipt of any income other than the scholarship, bursary, or other similar grant or award. So the word child is a bit comprehensive. Or it could mean a dependent, and we have defined the dependent that can enroll or with you as the contributor. So as I said, the benefits, because the scheme will run on the principles of solidarity, cross-subsidization, where the rich subsidize for the poor, the healthy subsidize for the sick, and the young subsidize for the elderly. So once you have contributed to a health insurance scheme, it does not mean that at the end of the year, if you did not fall sick, you'll go and claim a refund, or you'll go and say, what do you say? Roll over my contribution to the next what? Yeah. Okay? Because if you have not utilized, because of the principles of solidarity, the other people who are unhealthy would have utilized that, that contribution that you have put in. So that is what the NHIS is all about. As I come to the end with technical team, so they will be responsible for accrediting the health providers who meet the standards to be health providers under the scheme. They will supervise, monitor, and regulate the health care providers under this act. For purposes of better coordination, access, and quality aspects, the board may be necessary establish regional health insurance offices to be in charge of the national health insurance within the respective regions. The bill also states that all government hospitals and health centers shall be health care providers under this act. A privately owned health unit and non-governmental health unit may be a health care provider upon accreditation by the National Health Insurance Scheme. And the scheme will enter into contract with the health care providers, and payment mechanisms will be determined upon provision of the health care services. For regulation purposes, the NHIS will work in collaboration with the health professional councils, the Ministry of Health, the Insurance Regulatory Authority of Uganda, and private sectors, among other regulators. So what are our expected outcomes. Sawo ensure y'ebyobulamu oba ensawo abantu bonna abali mu Uganda abatuze ba mu Uganda mwe bajja okusobola okuteeka sente contribution enaaba egereddwa buli mwaka etusobozese okubanga twongerako mu ngeri y'ensimbi ze tulina okukozesa mu by'okujjanjaba abantu mu Uganda. So omutendera gwa insure eno kwe kutongoza engeri ene ya insure nga emu ku ngeri gavumenti gyesobola okufunamu esente oba ensimbi ez'okutambuza emirimu gy'ebyobulamu mu Uganda. Naye ekirala bwe tuba tufunye sente zino kijja kutuyambako okwongeramu okulongoosa mu mpeereza y'ebyobulamu n'okwongeramu okulaba nti abantu bonna gye bali basobola okutuusibwako empeereza y'ebyobulamu nga ya mutindo n'okulaba nti n'abasawo nabo balina bye bakozesa ebituufu oba eby'omutindo okubasobozesa okuba nga basobola okujjanjaba oba okuweereza abantu nga abantu bwe basuubira okufuna obujjanjabi mu ddwaliro. Entegeka eno eya insure gavumenti eyagala kugiteekawo nga egendera ku constitution ya Uganda nga gavumenti bwe yeekomitinga oba bwe yeewaayo okulaba nti buli muntu mu Uganda mwonna afuna empeereza mu ngeri y'okubeerawo ng'omuntu mu bujjuvu era nga gavumenti eraba nti buli kimu kimutuukibwako nga tewali kusosola. Ne tulaba nti era na kino bwe tugenda ku byobulamu bwe tutunula mu bye bayita Sustainable Development Goals, that one I can't change it in local language, naye SDG ekwatagana n'ebyobulamu ministry ey'obyobulamu eriwo kulaba nti buli muntu mu Uganda yenna tukola kye tusobola okulaba nti buli muntu yenna myaka gyonna ne buli waali afuna empeereza gye tusobola okumuwa mu bujjuvu. Naye nga mu kunoonyereza tusanze nti bwe tutunulamu mu by'ensimbi ezikozesebwa mu by'okujjanjaba mu bantu bonna wano mu Uganda, ekitundu 41 ku 100 sente ze tukozesa ziva 41 mu 100 ziva mu nsawo yaani y'abantu. Ate nga tumanyi nti gavumenti malwaliro gaffe tuweereza, we talk about free health care, bw'ogendayo tosasula. Naye olw'okuba ebiseera ebimu sente ziyinza okuba tezimaze bulungi, oluusi eddagala liggwawo kubanga abantu abalwadde bangi n'ebirala ebitatuukibwa ku mutindo, abantu beesanga nga balina okujja sente mu nsawo ne bagenda mu private clinic ne basasula. Naye kati tugamba nti twagala kukendeezaako enkola eyo wadde abantu basasula, naye tulabe nti sente ezo bw'oba oziwaddeyo mu insure oba weetegekedde mu maaso, katugambe bw'olwala, sigamba nti kati olina kulinda nti ndwadde kati kaŋŋende ntunde ente yange, embuzi, ntunde ennyumba oba ettaka nsobole okujjanjabibwa. so tubenga twetegese enkola ya ensure oba weetegekedde kyonna ekinaagwawo oba kinaagwawo oba tekijja kubaawo naye obeera mugumu n'omanya nti kati ki nze ebyange ebyobulamu kati ndi mwetegefu manyi nti nsobola okukolebwako. Kati mu insure eno tugamba nti buli muntu yenna ow'emyaka 18 n'okweyongera waggulu ajja kubanga ali eligible oba ajja kubanga alina okuwaayo oba kubeera member wa insurance eno insurance scheme. Naye bwe tugamba 18 n'okweyongera waggulu twongeramu ne tugamba nti katugambe nga omukulu w'amaka bw'abanga alina abaana ne wabaawo abo abali waggulu w'emyaka 18 naye nga bakyasoma tebakola oba balina obukosefu oba omuntu yenna wadde ali wa myaka 18 ng'alina obukosefu obutamukiriza kufuna income oba kufuna nnyingiza mu nsawo ye, oyo ye abajja kuba ku kaadi y'oyo eyeewandisizza nga yamusasulira. Ne bw'aba nga oba mukaddewo akaddiye teyeesobola gw'omulabirira nga n'ayita mu mutendero egigenda okuteekebwawo okusunsulamu abo abateesobola abanga ajja kwewandisa ku kaadiyo. So wajja kubaawo engeri aba ministry y'ebyobulamu ejja kukolagana ne ministries endala ng'eya gender, aba local government, ba LOCs, ba NIRA abakola ku ndagamuntu, tubenga tusobola okumanya ani abeerawa ennyingiza ye eryetya esobole okutuyambako okusalawo engeri omutemwa buli omu gw'anaasobola okuwaayo mu insure eno. Ekimu ku principles eziri mu insure tugamba nti insure kintu kyawamu, collective responsibility oba tulina okukwatagana ne tuba nga twerowoozaako ng'ekitole. Tekiriimu nti nze kubanga nze mmanyi sijja kulwala, nze omwaka oguwedde saalwala, nze ebyokulwala sirwala musujja, sirwala ky'abaana bange tebalwala, nze ebya insure tebinkwatako. Nedda, tujja kuba twetaaga okwekubirizaganya tugambe nti insure kintu kyakukolera wamu oba kiringa muno mu kabi. Okay? Tolinda kuba nze ebyo tebinkwatako, nze siri. Tujja kuba ng'owaayo ssente buli mwaka. Ne bw'oba nga olwadde oba tolwadde ssente olina okuziwaayo buli mwaka, tubenga tukolera wamu. Abo abalina bayambako abatalina, abatalwala bayambako ki abalwala, abakola bayambako abo abatakola ki abatakola. Tukolere wamu nga abantu ab'omu ggwanga erimu. So amalwaliro gonna aga gavumenti gajja kuba nga gasobola bw'obanga olina insurance osobola okugendayo, n'amalwaliro aga kinoomu oba agalina abagayambako nago tujja kuba n'engeri gye tuga accreditinga tulabe nga agatuuka n'omutindo ogw'okuwa insurance. Naye ne gavumenti nayo erikola butibiriri okulaba nti amalwaliro gaffe gonna okuva ku health center okweyongerayo gonna omutindo otugulongoosaamu, n'abakozi nabo babeerewo. Era n'ekirala ekirungi kya insure nti omuntu bw'ogenda omulwadde ku ddwaliro n'oba nga you are not satisfied, toli mumativu n'empeereza, olinawo okusobola okugenda apiiru gy'oddukira n'ogamba nti bannaye nze eyo nagenzeyo naye obujjanjabi bwawe si bwe nabadde nsuubira. Ebyo byonna mwebiri mu insure. Kale tetugamba nti abo bajja kutuyisa nga baagala batwale ssente. Nedda, buli kimu kiri kijja kukolebwa oli eddwaliro bwe liba nga abalwadde teribayisa bulungi wabaawo penalties, wabaawo engeri gye tujja kuba okulaba nti people demand for quality health services. Kale eno ensure bweneebeera ngeze ejja kuyambako abantu okulaba nti bw'aba alwadde tekimukosa nnyo kumuleetera ate kugenda mu bwavu kubanga atunze ako kaalinawo asobole okufuna obujjanjabi. Kijja kutuyambako okulaba nti abantu nabo abasinga actually abantu abamu tebagenda mu ddwaliro kuba bamanyi eddagala lyaweddeyo sirina ssente, kati obulwadde ne bumuluma ne bukula agenda okutuuka mu ddwaliro ng'obulwadde bwakula dda ate nga bwali badde yajjanjabibwa n'akola emirimu gye. Kale tulowooza enswa bw'ebeerawo abantu tujja kuba tubakubiriza okuba nga beekuuma mu byobulamu, okusobola okugenda mangu mu ddwaliro obulwadde buleme kkula kuba bw'obujjanjaba mangu ne ssente nazo ez'okujjanjaba teziba nnyingi, naye bw'olwawo ne bukula kiba kitegeeza nti era ssente olina kutoola nnyingi, ekyo ne kiba nga kikosa ennyingiza oba ne kirya ssente nnyingi nnyo. N'ekirala tusuubira nti nshuwa bw'enaabaawo sa omutindo gw'amalwaliro gaffe aga gavumenti awamu n'amalwaliro agaba kinoomu ge tulina muno mu Uganda. Era awamu wonna tulabe nti ng'eggwanga twongera okukula mu byobulamu naye ne mu nfuna nga Vision 2040 bwe